Dr. Brown, for being here. To start off, can you just talk a little bit about where you went to undergrad and medical school and then residency?
Yes. So I went to Tennessee State University in Nashville, Tennessee, Tigers. Um, and then I left there. And for medical school, I went to Meharry, which is also in Nashville, Tennessee. And I did my residency at St. Louis Children's Hospital in St. Louis, Missouri.
Did you feel like you had like a positive medical school experience or and I guess residency or
I thought it was definitely positive. Meharry is an HBCU also. So I would, had lots of classmates who are also African Americans like myself. Probably 70 of us came in that were African American, and then we had some other nationalities represented also. But it was just more like a family, so everybody supported, each other. It wasn't so much dog eat, everybody out for themselves, and
Right.
like it really was, everybody kind of, we were in this together, and we were going to make sure everybody made it through. So it was definitely more of a nurturing environment. I felt kind of like college. So I thought it was a very positive experience from that standpoint.
Because you undergrad was also HBCU. So did you apply to any PWI medical schools?
I did. I applied to the Medical College of Georgia because I actually was from Georgia. And I think that's the only one I applied to. The Medical College of Georgia. I applied to Meharry and Howard. Just thinking about where my life was at the time, like, do I go back home?
Right.
Stay in Nashville, because I knew Nashville. I had been there for 4 years in undergrad. And then Howard was another HBCU that was recommended by, some people around me that were also applying to Howard. So I applied. Those are the places I applied.
Okay, that's awesome. And from what I've heard from Meharry, that's a really good program and really well known. So both of those, Howard and Meharry, have a great reputation. I guess it just depends on what type of it comes down to a lot of things, but the cities are very different from each other. DC and Nashville. So,
and I feel like maybe I'm more of a Nashville kind of girl, I don't know if I was ready for a DC environment. So I was more of a Medical College of Georgia, Nashville, kind of Southern girl kind of thing. So.
Okay, like 6 years. I see that. So how did you choose pediatrics?
So basically, I really love kids. I love their spirit. And I actually feel like I'm still kind of a kid at heart. I joke around a lot. Sometimes I feel like I need to grow up and mature some more, but I just like the kids, their demeanor, and they're just so innocent. You just want them to, feel great all the time and let their personalities flourish. So I just kind of like kids, always have. And so I just felt like that's where, I needed to be.
Yeah. All right. That's awesome. So I was going to ask where you work now. So do you work in, I guess, private practice or public? And if you could explain why you chose that, because I'm sure there are many options as to how to best serve children.
Right. So I am in a private practice, which is kind of what I've always kind of imagined myself doing. Even as a young girl, I, thought about my pediatrician. She was in the office when I had an ear infection or ear pain. I went to see her in the office. And so that's what I kind of had in my mind is what a pediatrician would do. And so that's just I've always kind of been in this mode of practice, I guess. Yeah. So, and we have 4 different offices, and I pretty much see patients in the office most days of the week. About once every 10 days, I round in the hospital, and I see all of our newborns that's going to come to our practice when I'm rounding. So that's one practice model for pediatrics. I was in the military for 3 years as a pediatrician. So under that, I pretty much worked almost like in a private practice scenario, sort of, but I was on post. So I was a pediatrician for Air Force
Right.
airmen, I guess, and their families. So I would see their kids in an office setting that was just on a military base. I've also been, when I worked, and I've moved around a lot too, I must say, because my husband he was an active duty military lawyer. So we moved a lot. So that's why I've had all these experiences in all these different locations. But I've worked where I was in a private practice when I was at the University of Virginia. But I also had some teaching roles as an attending at the University of Virginia. So
okay.
So sometimes we would, I would have residents that I would, be responsible for
Right.
when I was rounding in the hospital. I have taught a physical diagnosis class for medical students that were in the medical school. So the first year medical students, I have kind of overseen like their learning for like how to do an exam and how to interview patients to get histories and physical. So I've done that.
You spend of course you spent some time in the public, I guess the public sector during residency. That's when you would have gotten that exposure to, I guess, non-private practice.
So in residency, you're basically in a hospital.
Mm-hmm.
So you're they call them the house doc. So when kids will come into the hospital, to the emergency room, if they need to be admitted to the hospital, then you're the doctor that's kind of taking care of them while they're in the hospital. But then you have second and third year residents that also like oversee, like if you're a first year resident, you have second and third year residents that kind of oversee and make sure you're doing the right thing. And you also have an attending that oversees all of that. So that was at St. Louis Children's Hospital. So a lot of the children's hospitals will be have residency programs associated with it. So if you go to, because they're really specialized. So like St. Louis Children's Hospital, they had pretty much all of the subspecialists there to just take care of a lot of tertiary type of patients.
Mm-hmm. But you could have stayed in the hospital if you wanted to, right? And been like a hospitalist, but
right.
You chose to do private. Is there a difference in the types of patients that you see every day in a hospital versus not?
Yes. So I see most of my patients are healthy. So as a hospitalist, everybody would be sick. So you would probably always see sick people, and you would see them until you've gotten them better and discharging them home from the hospital. And then you may not ever see them again. So I see my patients are typically healthy, and I see them multiple times throughout the year. So at least once a year for their well visits. And then they come to see me if, they're having a particular problem, say ear pain or a sore throat, fever, a rash. Those are kind of typical sick visits that I might see. So the difference is just that my patients are typically healthy, and I am doing more preventative care to keep them healthy, to keep them out of the hospital, as opposed to a hospitalist. They're sick and they have to take care of them and get them better to get them back home.
Yeah. Can you talk a little bit about the scope of the work you do, and I guess what a typical day in your life looks like?
Okay, so for me, my current practice, we basically see newborns all the way up to the age of 18, or once my patient has graduated from high school, 18, and have gone off to college. A typical day for me, I usually start around 8:30 seeing patients. So I'll see a patient every 15 or 20 minutes. And it's kind of a mixture of, routine annual exams versus, a sick visit that they're concerned about. So I'll see patients in the morning, I break and have lunch, and then I come back from around 1:30 to about 4:15 and see the afternoon patients. And then when I'm done with that, I kind of just finish up all of my charting or, make any calls I need to make. And basically I go home. And
Mhm.
so then I'm home until the next day. Now, like I was saying earlier, is, every 10 days I round. So like today was actually a rounding day for me. So instead of going into the office, I went to the hospital and rounded on. We had 6 newborns today. So I saw 6 newborn babies that are going to follow up in our office once the moms are discharged from the hospital. I had to do 2 circumcisions. Not my favorite thing to do, but I took care of that. And once I was done actually rounding, then I was done for the day. And so even that is going to be kind of unique depending on how your practice sets things up, because it's different. It's been different everywhere I've worked as to how you do rounds. And some practices don't round at all. It just depends on the setup in your area of how that works. But from our practice, we round on our newborns. Now we don't see our inpatient, like if I had a kid who came in and was sick and had pneumonia or something and needed to go into the hospital, then the hospitalist actually will take care of that patient for me.
Right.
And once they've fixed my patient, got them ready to come home, then they would come back to see me for follow-up.
Is it typical to have so many rounds? Are those patients already established patients before they deliver, or are you rounding and then you were kind of collecting patients along the way?
So it's a little bit of both. So sometimes, they are, patients of mine who the mom is now having a sibling for them. Mm-hmm. And so they will say, well, Dr. Brown is first child's patient and we want Dr. Brown to be the next baby's, pediatrician, I'm sorry. And so sometimes we do get just families of patients that way. Then there'll be new people who, sometimes I get new moms that come into the office to interview me when they're pregnant to see if they want to pick me or some other person in our office as their pediatrician. And so sometimes we get patients that way. And so when they go in to deliver, they'll tell the people at the hospital that they've chosen Dr. Brown as the pediatrician. And so they'll notify our practice whenever someone has chosen us as their baby's doctor. Mm. And then there are people that just Google. They look up pediatricians in the area, and I've had people come in and say they Googled me and they read my small bio on our website and they chose me. And so we get patients that way a lot.
One of the most challenging cases that you've had?
So let's see, challenging cases as a private practice doctor. I wouldn't say that they're challenging, because I will say when I get like a difficult case, a lot of times I will transfer them to a subspecialist. Mm-hmm. So like if I get a new onset diabetic, type 1 diabetes, so that usually I let the endocrinologist, pediatric endocrinologist, kind of handle that because it's more of a specialized care. So I would say my difficult patients, a lot of times they get transferred to the appropriate subspecialist to kind of take over. But I say for me, when I say difficult, I do have cases where it's just heartbreaking. Like it's heartbreaking for me to tell a parent, that their child has diabetes. So I've had that before. I've had a case, where I had to tell a mom that her son's x-ray was actually a bone tumor. It was a cancerous tumor. So those cases, not that they're challenging, but it takes away from your emotionally, it's taxing emotionally, because you kind of know what that means for that kid who is always the nicest kid, the nicest family. And you just know, what's in store, what's ahead for them. And so for me, those are challenging cases. Or even to have to tell a young lady, that maybe her pregnancy test was positive. So for me, those things, are challenging for me, I guess, because emotionally draining for me. And, I just worry so much, about, I just know those things are going to change the trajectory of that child's life.
Mm-hmm.
And I hope that it can be a positive change, just despite, maybe not the most positive news. But to me, that's for my job, that those are the challenging cases for me, just getting bad news and having to deliver bad news and not knowing, just knowing kind of what they're going to face and not knowing what the outcome is going to be.
Right.
So for me, those are the challenging ones.
And how do you like compartmentalize that though?
It's very hard. It's hard. And sometimes I don't. Like I do carry that, with me, and sometimes it may affect my day. It really will affect my day. I go home, it affects you. So, and I would say, and that's part of the reason too, why I choose not to work in a hospital, because usually kids in the hospital, they are sicker. And I've just seen a lot of illnesses that didn't go well for the child. And I know I'm very sensitive, and I can't be walking around the hospital all day crying. Right. I do have to see patients and maintain some decorum. And it's just, I need to see happy faces, kids telling me jokes, just knowing that I'm keeping, people well is very rewarding. And I don't know if me personally could deal with, even if it's, once every 4 months that I'm having to deal with something terrible. That would be emotionally draining for me.
Right. Yeah. I'm not sure how people do that every day. What do you feel like are the strengths that help you in your job? Do you feel like there are certain characteristics of yours that are really beneficial, or are there things that you wish that you're better at?
Well, I wish, like I always say to people, and no one believes me, but, I do feel like I am sort of an introvert. So I feel like if I were not an introvert, if I were a little bit more, socially outgoing, that would make life easier for me. I'm better with one-on-one, conversations. So I think that's helpful with my job, because I pretty much see people one-on-one. I don't like doing a lot of like speaking engagements. I know that's a lot of people's social anxiety is, speaking in front of crowds. But I feel like I don't have that. I don't know. It's just something like, it just makes me very nervous to have to speak in front of, large crowds of people. Partly, and that's probably partly why I chose to be a doctor. I felt like, and I think back to my pediatrician, she was kind of, she was quiet and, down, strictly to, what I was there for. She may have, said something nice or told a little joke, but it was very, it was just very straight to the point, and she's very professional. And that was that. I'm like, oh, I can do that. It's not like I have to go out and do a presentation every week for my boss, like that, I think would probably be the end of me.
Yeah, because that's when I'm looking for a doctor, that's something I'm actually looking for. Someone who is just kind of gets to the point, because I can be kind of introverted and also kind of extroverted. And when I'm at the doctor's office, I often just want to get to the point and I don't want to be asked too many questions that aren't related and just chat. I'm more of like, okay, this is what needs to be done. Okay, great. These are the steps, and that's it.
Okay.
So I think everyone needs a different thing.
Right. That's true.
Funny. Yeah.
Yeah. So I just felt like, I'm kind of an introvert. So I feel like actually my friends will say I'm an extroverted introvert. So I feel like that works well with me, in my one-to-one interactions with my patients and their families. So.
Yeah. So that's a strength. Okay. You turned it into a strength. Do you feel like there are any others as well, or would you just want to?
Yeah, I feel like I'm very flexible and accommodating. I think I'm really easygoing. Um, but I think, gosh, I work hard. I do want to get things done. I like to get things done correctly. So
Mm,
I like doing things right. So I think that has helped me, just throughout my life. I do want to do the right thing all the time. Um, so I think that's one of my strengths.
so I'm sure, we just look at our healthcare landscape right now and it's full of inequities. Um, do you feel like there are any particular steps that need to be taken? Um, any first steps that come to mind that can be taken in order to kind of combat this issue?
Yeah, I think, people need, jobs with wages that can support a family, with benefits that can provide health care insurance. I think that's the main thing. If we can have a society where everyone can be gainfully employed, um, where they can take care of their families, it would solve a lot of issues. So I think that's one step. And whatever needs to happen for that to happen, I would say would be the first steps. There are lots of distrust, out there in the medical field, or seem like there are people that don't necessarily trust the science, it seems. So we need to work on that. Maybe we need some marketing to help, doctors. I mean, I don't think it's the masses that are distrustful of medicine, but there's just a subset of the population that is just very into conspiracy theories and distrusting doctors and government. They just distrust everybody. So we got to get past that too. Come in for their preventative services, and I think that's going to be the key. If we can get more people on board with their prevention, that may do a lot to help healthcare as a whole in the future.
Right. Yeah. I completely agree with that.
Yeah. Preventative care will go a long way to help save a lot.
Yeah, I completely agree with that. And I've also often wondered why, is it's 2020 and still we focus more on fixing the symptoms than the actual issue. So I completely agree with that. Preventative medicine, I would love to hear more about it and like learn more about that myself. You just mentioned parents, and it made me think, when you, as a pediatrician, do you feel that you are dealing with the parents just as much as you're dealing with the children, if not more? You have to not only, it's almost like family medicine in a sense, that you have to know how to deal with the whole group. And
yes, you're definitely dealing with the parents and the grandparents. So definitely more so than the children in the beginning. Teenagers may come in and it's more, about the teenager, but younger kids is really, a lot of times we're dealing with the parent.
Yeah, it's like alleviating their fears come into play, in your position. And is it more of a benefit or of a challenge? Yeah, I'll just leave it at that.
That's a good question. Definitely race, I'm sure, has played many roles. And like the most common one, and I don't know if it's a race issue or a sexism issue, but I do get a lot of people responding to me as, yes, Miss Brown. And I don't know if they just can't accept that a female can be a doctor, or that a Black female is a doctor. Like, I don't know if they're thinking I'm the nurse practitioner or the nurse, but so I used to get that a lot, where, it's like I don't know. I just don't know what it is. If it's just that they're just not used to seeing a Black female
Right.
as the physician, and it depends on where I am too, because I've worked kind of all over the U.S. in different regions, but actually it's the same everywhere. Yeah. Like they know you're the doctor, I guess, but.
Mm-hmm. I mean, before you come in, the nurse says the doctor will be in shortly.
Right.
So
now I've even been places where I'm in there and they're like, well, when is Dr. Brown coming in? I'm like, well, I am Dr. Brown. And,
she has arrived.
That would be me.
Yeah. But I'm sure that when a male comes in, that there's no question that he's the doctor.
Right. And sometimes, like I've had male nurses, and it's like they were really confused because they thought that my nurse was the doctor, and so I'm like, no. So that's one thing that I have encountered, and I'm sure lots of female physicians probably have encountered. I don't know if my Caucasian female physician counterparts encounter that at the same level, but it happens quite a bit. And then there are some positives. So I will get some African American patients that are very happy to see me and happy for their children to see me in my position, so that they can see someone tangible that is a doctor. So that they can see themselves in those positions one day. So that's always a positive.
Mm-hmm. I wanted to ask you if you felt like you had to deal at all with imposter syndrome, being an African-American professional. I mean, that's something that I've heard exists in the professional landscape. I haven't been, obviously I'm still an undergrad student, but I know that I've dealt with imposter syndrome myself. I would assume that it is there at every level. And if you've ever questioned your worthiness or felt like it was questioned by other people.
Probably I've done that before. I don't know if I've ever thought anyone else was questioning it. I always know, like I know what I can do, and going back to the introvert stuff. So as an introvert, I don't talk a lot. In meetings, like I am very. I don't know if that's part of the imposter syndrome, but I really do like I take in so much information. I just listen. I'm a big listener, and I really kind of put all the information together and form my opinions, but I don't really say a whole lot. So, maybe people may feel like, oh, well, maybe she doesn't know a whole lot because she's not saying a whole lot. But it's not because I don't know a whole lot. It's just more of me just not feeling comfortable enough to say, what I want to say. And then, maybe me not feeling that maybe my opinion won't really matter. So maybe that's part of the imposter syndrome. Maybe I just feel like I'm just not as important and it really doesn't matter what I say. Yeah. So I just keep it to myself and just listen to what everybody else is saying. So maybe that's part of it.
This is the part I was looking forward to. I wanted to know if you have any advice for people who are going into the medical field.
Yes. So what I find myself saying to students who say they, want to be physicians, always try to dispel the myth that you are not going to be in school forever. Seems like that's something that's told to them by people who are not in the medical profession, and it can be discouraging that you're going to be in school forever. Oh, you want to be a doctor. And I tell them all the time, it's not school forever. You do your 4 years of college and 4 years of medical school. That's all the school. After that, you are a doctor. You are a medical doctor, DO. You are a doctor. And when you go to your residency training program, you are a doctor in training, basically. It's on the job training. You are no longer in school. You're getting paid a salary. And you're learning on the job. So it's really only an extra 4 years of medical school. And for medical school, it's 2 years. Well, when I was in school, it was 2 years of classroom time, and the latter 2 years are in the hospital. Mm-hmm. You're learning. You're rotating through different specialties, learning what they do, and then you can kind of decide, which one you would like to do. So you don't even have to know what kind of doctor you want to be when you enter medical school. You still have 2 or 3 years to kind of make that decision. So, but I'd always say, so first off, it doesn't take forever to become a doctor, and it's not a lot of schooling. And for you to even feel like, you want to be a doctor and you can be a doctor, that means that you must have some confidence in your intellectual ability. Mm-hmm. And if you did well in high school, you liked your science classes, you did well in high school, there's no reason why you cannot succeed in doing the same thing in college and then medical school. So if that's something you want to do, do it. Yeah. Just commit to it and get it done, and it'll be over before you know it.
I definitely heard growing up, it's school forever. Oh, I can't be a doctor, that's school forever. Right. And then you have to go back and say, well, what is it really? Residency? Yeah, you're already a doctor, you're still technically learning, but then what job are you not continuously learning in? Hopefully you're always continuously learning. Right. And a job. So it's just, and nowadays, you can't it's harder to just graduate from undergrad and not go to grad school. A lot of people find themselves needing to go to grad school to be competitive anyway. So right. There's less of a gap of all the 4 years of medical school.
Exactly. Because then you have people that are in grad school, so that you're all going to be getting out around the same time, starting your careers. So,
a lot of people, African-American people, look at HBCUs versus PWIs. But for medical school, would you say there's a big difference between private and public medical school?
No, I think medical school really is medical school. Human gross anatomy is gross anatomy. Mm-hmm. So I really think it's going to be the same. And even residency programs, yes, you have some residency programs that are ranked higher than others, but in the end, when it comes down to getting a job, people just care that you have the appropriate training, you went to an accredited school, an accredited training program, you passed your licensing exams, and if they have a position open, you can likely get that job. So it really doesn't matter, if you went to Harvard Medical School versus Meharry. I've worked in the same places with people who went to Harvard, medical school, and we were equals. Yeah. I just say wherever you are, make the most out of it. Same thing for undergrad. If you're at an HBCU or PWI, I would just say, just always have, your goal. You need to do your best work, put your best foot forward, and that'll get you to the next step. So, but you can't go, somewhere and just be lax about it.
Yeah.
You can't, I couldn't go to Tennessee State and be a C student. That probably would not have gotten me admitted to a medical school.
Right.
So you just have to, when you do go places, you just gotta do your best. You always want to do your best. Because the rate limiting step really to becoming a doctor is getting into medical school. That's usually the do or die moment, where there are lots of people who apply and don't get in for whatever reason. But that is once you get accepted to a medical school, the rest, your destiny is up to you from that point. You have control, and you're on your way. Nothing should stop you at that point.
Oh, right.
You have to graduate from medical school, and then residency is the next step.
Yeah. So really, the determining factor, you said, getting into medical school.
Yeah, you can, like I said, if you get into medical school, you do well in college, you can get pass and get out of medical school. You can pass any boards. You really can. There's a lot of things that can help if if you're bad at taking tests. They have board review programs, just like they have SAT review programs to help people. So there are programs to help you take tests. If you have test taking anxiety, there are tips. So, but you can do it. Like say if you can do well in college, it's very similar work. Medical school is a lot of similarities, but it's really all about, can you endure, can you fight through the hard times, with just determination. If you have that determination, there's nothing can stop you. Just believe that. You just have to believe that,
Yeah. I think we could all use a little bit more of that.
Yeah. Just believe in yourself. Like I say, to even think that you want to be a doctor, you have something there in you already.
Is there any myths you like to dispel now, or something you feel like people should know about the realities of what it actually is like?
So I have kind of a funny story regarding that. So, growing up, there were, I don't know, like soap operas. That people watched a lot of soap operas. I don't know if they do that anymore, but and I think soap operas may have given a false sense of what it is to be a doctor. Maybe it's that way for some doctors, but not for myself. But I remember in residency, when I was in residency program, I was walking around the hospital, came across some young ladies who were looking, for directions to get somewhere. And through the conversation, they realized that I was a doctor, and they were African-American ladies. And then they were just so like, oh my gosh, I can't believe it. You're a doctor. Oh, wow. And then one of them was like, wow, all those doctor parties you must go to. And I just like,
doctor parties.
Right. And it just kind of made me laugh, because I'm thinking that was the thing that came to her mind was doctor parties. I'm like, I'm in residency. I hardly ever see the light of day, let alone a doctor party. So I don't go to very many doctor parties. Probably because I'm an introvert. I don't know. But yeah, not a lot of doctor parties out there. And then I think the other one too is, financially, as a physician, I do well. I can't complain, but not all doctor salaries are created equal. So I would just say that.
Yeah. And that doesn't just depend on specialty, right?
Yes, it kind of does. So different specialties will make different salaries. Subspecialists will make different salaries. It depends. So yeah, there's a wide range of salaries for physicians depending on your specialty. Yeah.
And thank you so much for letting me interview you.